Oh, hello. See one person on. So we'll give a couple minutes here and see if we have other persons join. All righty. Well, I have 1 minute after one, so we're going to go ahead and get started. Um, and I apologize. I haven't been keeping track of who's been attending. So have either of you attended a previous session?
I have not.
I have not.
Okay, perfect then. So what we will do is change things up a little bit. So I've already had two previous sessions, and since neither of you have attended those, I do want to backtrack and talk about how this exam is supposed to be prepared and written, because that will give you some help when you're taking it. So let me just get that file open here. I'm going to share my screen here in a second. Also, the other thing is I'm working from a hospital, so I don't have my typical setup with multiple screens. So just bear with me while I'm trying to get these things shared on my computer here. Okay, so you should be seeing, and it says NBE and MBME. Do you guys see that? I can't
Yes.
see you anymore. Okay. So this is the National Board of Medical Examiners Writing Guide. And persons who write for NAVLE are supposed to follow this guide. So I'm going to kind of skip ahead. So the first section is, all about the why about testing, why it's important, and et cetera, et cetera. What I want to spend some time talking about right now are testing format. So the NAVLE is a multiple choice test, right? And there are two types of multiple choice questions. There's the best answer question and the what I call the regurgitation question, or a true false fact based question, where only one of the distractors is correct. With the more than one option or best answer, all of those distractors are correct, but one is more correct. So here's an example. Which of the following, if not performed, for a patient with GDV, would be harmful? So provide pain medication, provide supplemental oxygen, hook up an ECG, provide IV fluid therapy for resuscitation. So for the GDV patient, if we don't hook up the ECG, okay, it doesn't, is that going to kill the pet? If we don't give it pain meds, is it going to lead to its demise? If we don't give it oxygen, maybe, but I know if we don't give it fluids, that's going to be a problem. So those questions are a little more difficult because everything is correct. You need to prioritize your answer. Does that make sense?
Yes.
So, sorry, let me, don't have my mouse either, so it's making things tricky. Okay. So for the one best answer, a couple of points. Number one is question writers are usually lazy, meaning in the stem or the actual question portion of the question, there is going to be information that is key to including to make sure you get the correct answer. So most, I'll say, large animal questions or food animal questions, um, there are one of two types. It's either herd health or an individual that you're examining. So it's important to make note of that because once if the question starts with you're on a farm examining a herd of cattle, that should immediately put your mindset into this is herd health. What do we talk about with herd health, right? We talk about husbandry, we talk about nutrition and diet and infectious disease, right? Those are the main things. So it helps set where your memory banks should kind of go um, when you read that stem. The questions are only supposed to have 4 or 5 distractors, A, B, C, D, A, B, C, or D, or E. Only one answer is supposed to be correct. So they should not have options of all of the above, none of the above, A and C are correct, D and B are incorrect. Nothing like that should be on the exam. Questions should be written in a positive format, meaning there's no negatively written questions. So that question I gave you, which of the following except all of the below but one. Um, that is improper question writing. Now the problem is those questions do still end up on the exam from the exam bank. Another rule they're supposed to follow is that you should be able to answer the question without reading the distractors, meaning it should be specific enough where you should be able to answer the question from memory if it is one of those true false questions, not if it's a choose your best answer question. 2 points of advice when taking multiple choice exams. Number one is when you are unsure of a question, right? You're going to circle it or highlight it and go back to it, right? At the end of the test when you have a little extra time, hopefully. So that is my recommendation. If you don't know the answer or you're in between two different distractors, go back to that question because hopefully, if you stay on that question for a long time and start, getting in the weeds of it, you're going to lose precious time to answer some gimme questions, as I call them. Um, which would be like, rabies is what type of virus, right? There's always questions like that on the exam also, which are just rote memorization. Boom, I know that answer. It's going to be, I don't need to spend a minute on this question. I can spend 15 seconds because I know it right away. So mark the ones you don't know and go back to them. When you do that, when you go back, only go back to those questions you didn't know. I taught in academia for 5 years and can tell you every time I did a test review with a student, when we reviewed their exam and they're like, oh man, I went back and I changed that one. Almost always, if they knew it and didn't mark it, that I'm uncertain, they would change it to the incorrect answer. So only go back to the questions you weren't sure about and mark those. Don't start checking everything because you're going to change answers that are correct, right? There's that, there's a reason your gut feeling or that initial, jerk response is usually the right one. When you go back and you start overthinking and overreading questions is when you start to, erase your correct answer and mark a wrong one. That's my number one advice. My number two advice is if you don't know, you have no clue what the answer could be, choose the longest distractor. Exam writers are biased and they tend to put more detail in the correct answer. Okay, so those are some basics about how the exam is written. So here's an example of a true false question, right? So basically there's a statement and it's asking you a fact and you either, it's either you either know it or you don't. Um, so here, which of the following are X-linked recessive conditions? In this example, now this is a human test, so we're not going to know this stuff that well. But if we made this a dog, right, it would be, probably hemophilia, right? We know that that's X-linked. So basically, the way these questions are written, you go through the distractors and answer, is this correct or incorrect, right? It's basically four true false statements, right? Cystic fibrosis is X-linked recession. True or false? Muscular dystrophy, X-linked, true or false? So that's kind of how those work. Do you guys have any questions so far about how the exam is written, or some quick and dirty tricks I just shared?
No.
Okay, so let's look at an exam then. Blow this thing up here. Okay, so let's look at some questions here and work through these together. Which of the following is the most common cause of maxillary sinusitis in the horse? Okay, so we got a lower respiratory tract infection that spreads into the sinus. We got a tooth root abscess into the sinus, foreign body inhaled, and a puncture wound. Right? All of those things could cause inflammation of the sinus. Which is more common? Let me make sure this is sharing. Okay. Sorry if that wasn't sharing. Can you guys see the question now?
Yes, I can see it now.
Okay.
And I would say B, the infection and abscessation of a tooth root extending to the sinus.
Yes. Yep, that's correct, right? All of those can cause sinusitis, but the most common one would be a tooth root infection, right? Inhaled foreign bodies, yeah, you might see one or two your entire career as a veterinarian. They're not. I mean, think about yourself, right? How many times you have a toothache versus how many times you snort something up your nose by accident. Puncture wound, again, that's a a freak kind of accident, but we definitely see, you know, I'm not sure about horses, but I know in dogs and cats, the number one diagnosed disorder is dental disease, right? 80% of dogs and cats by the time they're between 2 and 3 have tartar and gingivitis and dental issues. All right, excellent. Okay, next we have like this thing. Okay, number 2. All right, this brings up another point about the questions you're going to run into, which is called double jeopardy. They're not supposed to write questions that inflict double jeopardy. And what do I mean by that? Questions like this, where you need to know the diagnosis and the treatment. And the question is about the treatment, right? So, for example, they would say, you're examining a 10-week-old puppy with vomiting and diarrhea. You look under the microscope, you do a fecal float, and you see, and they show you a picture of hookworm. And then they say, which of the following, therapies would you use to treat this uh, parasitic infection? If you don't know that what hookworm looks like, you get it wrong. And if you don't know how to treat hookworm, you get it wrong, right? So that's a double jeopardy question. So those again are on the exam. They're not supposed to be, but it's really hard to write a question about treatment without giving the diagnosis. So they try and combine those to really test your knowledge, but it really like I said, those sometimes are when they review the exam, they have to get rid of them. So here we have an African gray parrot presented for necropsy. Here they give you the diagnosis. They suspect it has psittacosis. Which of the following is most likely to confirm the diagnosis? So you need to know, this is a little bit of double jeopardy. So you need to know what psittacosis is and how you diagnose it. So we have hepatomegaly. So this is, again, one of the choose the best answer potentially kinds of questions. So we have hepatomegaly and splenomegaly on gross exam, identification of organism by gram stain, isolation identification of chlamydia, and acid-fast organisms in the liver. So just looking at these distractors, only one of them actually even mentions, right, has an actual uh, infectious agent listed, right? The rest of these, hepatomegaly and splenomegaly, if I remember, I don't remember avian medicine that well, but I know that a lot of stuff they run into causes that. Gram stain, right? Just even if we don't know what psittacosis is, like I don't remember what it is, what it's caused by, but I do know what a gram stain does, right? It stains positive and negative, right? Types of bacteria. And if I do a gram stain and I see gram positives, that could be staph or strep, right? They're both cocci. I don't know which one it is. Same thing with acid-fast organisms in the liver. Yes, it does narrow down the diagnosis to the liver, and they have to be a certain type of, or most acid-fast organisms are atypical mycobacteria, or even some certain types of fungi are acid-fast. But again, it doesn't give you a definitive diagnosis. So the only one that does is C. So I hope that makes sense. Okay. Okay, so here we have a 5-year-old Holstein cow being evaluated because of inappetence. So the other thing I recommend you do is you should be able to like highlight stuff because you take the exam on ExamSoft. So with this STEM or question, right, we get a lot of information here. So I want to make sure, I'm paying attention to the important stuff. So I got a 5-year-old cow, right? So I'm just dealing with a single patient, not a herd. Okay, they're not eating. So I'm going to highlight inappetence. I got pinging over the 9th and 10th intercostal spaces. They do a synthesis and they get green fluid with a pH of 6. Where is that fluid coming from? Okay, so you need to remember a couple of things, right? Cows that have inappetence, and on physical exam, right? Pinging, that usually means there's something out of whack with their GI. There's some kind of displacement potentially. And to figure out what's being displaced, is it a displaced abomasum or is it the cecum or whatever? You sample it, and the different areas of the stomach in the cow have different pHs. Okay, so this is a little bit of a trick question. So what do you guys think? Abomasum, cecum, omasum, rumen, or spiral colon? What two options on here make you really anxious or make you like, if that was a dog, I hope they didn't get a sample from that area? What would you be concerned about?
Is it the spiral colon? I would be.
Yeah, you don't want to stick needles in the colon or the cecum. So, I would eliminate B and E, even though I don't remember anything about large animal. So we have abomasum, omasum, and rumen. So you need to know which one has a pH of 6. And what do we see as far as cows go with the left side and abnormal displacement of the GI? What's a common disorder we see with cows?
Left displaced abomasum.
Yeah, an LDA, right? So I would say it would be A. That makes sense? All right. Now we're getting into somewhere we can hopefully figure out a little bit better. Okay, so this one, we have a 3-month-old puppy, weight loss and chronic diarrhea and steatorrhea, right? Fat in the stool. So we have a direct exam, and we see motile piliform trophocytes on a direct, right? Didn't even float it. So this is a double jeopardy, right? You need to know what this organism is and how to treat it. Okay, so what do you guys think the problem is with this puppy? A 3-month-old puppy, weight loss, diarrhea, steatorrhea, motile piliform trophozoites.
Is it giardia?
Yeah, it's giardia, right? So what do we use to treat giardia?
Metro.
Metro. Perfect. Metro. Excellent. Okay. So you probably heard this, hopefully, at a NAVLE review at school. But when it comes to food animal, to production medicine, definitely know your infectious agents, the viral ones specifically that cause respiratory and GI issues in pigs, avian, right, poultry, and in cattle for sure. They always have a question about shipping fever or an outbreak in a poultry in a poultry facility with influenza or something like that. There's always going to be a herd health infectious disease question about viral diseases, right? So here we have an infection of pregnant cows. So this is herd health, right? So they're talking about a whole bunch of pregnant cows with BVD may cause what neuro problem in a newborn calf? Okay. So anencephaly, cerebellar hypoplasia, hydranencephaly, hydrocephalus, or syringomyelia. So anencephaly, they're born without a brain. Cerebellar hypoplasia, it's a cerebellar developmental issue like we see in cats that have pan-LUC. Hydranencephaly and hydrocephalus are similar but different, right? Hydrocephalus is too much fluid in the semilunar canals, and hydranencephaly is basically like cerebral edema, water on the brain, so to speak. Syringomyelia is loss of the normal crenations, right? The sulci and the crenations in the that give the brain that extra surface area. So are these newborn calves exposed to BVD? Are they born without brains, or what do you think is going on with them?
It would be cerebellar hypoplasia.
Yes, cerebellar hypoplasia. This is similar to pan-LUC in kittens. Perfect. And this is one of those true false questions, right? You kind of like a recall question where you have to hopefully recall that information in your memory banks. All right. Here we have a 9-year-old Boston Terrier. He's got a mass in the inguinal area. Okay, you do cytologic examination of an aspirate, and we have round, discrete cells with purple granules. Okay, we got a problem in the lymph node. Okay, so the lymph node's enlarged, and we see cells in the blood and in the lymph node. Which of the following is the most appropriate management, right? So here, this is almost triple jeopardy, right? So number one, you got to figure out what the mass is. Number two, they've graded it for us, right? They've given us some information on, you know, when you're suspicious of cancer, right? One of the ways we prognosticate is through staging, where is it in the local lymph nodes? Has it spread to the lungs, right? We take an x-ray. If it's lymphoma, is it in the blood? So you have to know about staging a little bit, and you have to know about cancer in dogs. So they're telling us it is under, when you look at the sample, we have round discrete cells. Okay, so that is telling you it is a round cell cancer. Do you guys remember the 5 types of round cell tumors? And if you do, start blurting them out for me.
Mast cells are one of them.
Mast cell tumor, yes. What else?
Lymphoma.
Lymphoma, good.
Is histiocytomas are also? Yes, I don't remember.
Malignant histiocytoma, yes, because that's tumors of the macrophages. So it's sort of, it's usually not on the traditional 5-cell list, but I could see it being like a subset of lymphoma almost. So we have mast cells, lymphoma. There's one that's spread through mating, and usually with one treatment with chemo, it's curative. It's like the best
TVT.
cancer to have. Yep, TVT. Good. 2 more. So if this description, instead of saying reddish purple granules, what if it said black amorphous cytoplasmic material?
Melanoma.
Melanoma. There you go. Number 4. And number 5, again, it's almost like a subset of lymphoma. It's malignant myeloma, which is basically a B cell type of cancer. So those are the 5 round cell tumors. Which one has reddish purple granules?
Mast cells.
Mast cell. Okay. So What do you know about mast cell tumors in the inguinal area? So now we're going to get into grading. So we have a mast cell tumor. Now we have location, we have it in lymph nodes, and we have it in blood, right? So do you guys remember like the mast cell staging, how it's staged? So would you call this so usually we grade mast, so there's an old staging system, grade 1, 2, and 3, and then there's a newer system. But if we did the old system, grade 1, 2, or 3, what would you think this dog has? Like, do you think this is, oh, it's just, it's just localized, we can get rid of it easy, or is it, oh shit, I think this spread? What do you guys think? Because they see these cells in the node and in the blood.
I would say that I
It's
think it's
Definitely
spread.
spread.
Yeah, so grade 3, right? It's bad. Mast cell in male dogs in the inguinal area, that's one of the most aggressive sites, is in the inguinal area. So this is a high grade metastasized mast cell tumor. So now that leads us into how we would treat it, right? Because if it was localized, what if instead of it being in the inguinal area, what if they said there's a 2 millimeter nodule or 1 centimeter nodule on the ear, the tip of the ear, and when we sample it, we see round cells with granules in them. What would you do for that? If it was just on the tip of the ear, how would you
So
treat
just
that
remove
one?
it.
Remove
Yeah,
it.
you would excise it, right? Well, what about this one? Are you going to excise it?
No.
No, it's already
We-
spread, right? It's already
Probably do like
spread.
chemo.
Yeah, well, let's look at our options here, right? So we got chemo, cisplatin, and aluminum hydroxide, levamisole and aspirin, pred and cimetidine, conventional surgery or cryosurgery, right? So we all just said, look, surgery is not a good option, right? So we can eliminate D and E. Now we're left with A, B, and C. So the mast cell granules, do you guys remember, like, what do they contain sometimes that worries us? And why, when we do surgery, we have to pre-treat them with certain things?
Histamine.
Yes, histamine, right? So usually when we treat mast cell patients, we have to give them a histamine blocker, and then we have to give them something to either kill the mast cells or diminish their growth, right? Slow them down. So what do you think? So would we give levamisole and aspirin? Right? You
No.
just said histamine. What does histamine do in the stomach? Guys, remember you probably took some before the exam last time because you had some acid reflux. Right? You probably took some Pepsid or something, right? Histamine causes acid release, right? And we know aspirin causes ulcers, so I wouldn't want to give anything that makes that worse. So I can get rid of B, even though I may not even remember what levamisole is. Do you guys remember what cimetidine is? What kind of drug that is?
An H2 blocker.
Yes, it's an H2 blocker, right? It's a histamine blocker. So that sounds pretty good, right? We have histamine in these granules. So C is the only option that treats the side effect of the mast cells causing ulceration and also the mast cells themselves with prednisone. Prednisone can be cytotoxic to lymphoblasts and mast cells. Now, if A said cisplatin and cimetidine or famotidine, then that would be the correct answer. But aluminum hydroxide does not, does not treat ulcer or does it do anything to mast cells. So that one's a little tricky. That one's a little difficult because And again, it's poor exam writing. You shouldn't have two options for every answer. It should just be a single option, but these do slip through. Oh boy, we got a piggy one. Okay, so we have an acute outbreak of vomiting and diarrhea. 1-month-old piglets, right? So this is herd health. And they have high morbidity and high mortality. If you need me to move, just let me know if I'm bugging you. I took over somebody's office. So. Okay, so what acute agent causes high morbidity and and high mortality GI issues in 1-week-old piglets? Okay, so we got Clostridium perfringens type C, colibacillosis, rotavirus, transmissible gastroenteritis, vomiting and wasting disease. What do you guys think? You're gonna have to help me out because I don't remember my pig stuff.
Is it the Clostridium type C?
I think it's D. Let me look at my answer key here. It's transmissible gastroenteritis. So I eliminated E right away because vomiting and wasting disease sounds chronic, right? And this says acute outbreak. So again, this is one of those you have to know these agents that cause GI signs in pigs and cattle, and when they and when it causes problems during their life stage. Okay, here we go. So another recall question. Which of the following abnormal cardiac rhythms is most frequently seen in dogs with GDV? So we have atrial premature complexes, junctional escape beats, second-degree AV block, sinus bradycardia, or ventricular premature complexes.
Is it VPCs?
Yes, VPCs. So when we have disease of the abdomen, right? So when we have bloat with or without volvulus, or when we have splenic issues, right? Splenic tumors, splenic torsion, splenic infarction. Many times those dogs will also have cardiac arrhythmia. There's a lot of theories as to why that happens. There are still people holding out that there's some hormone or vasoactive agent released by the spleen when it is diseased. Most persons feel that it's due to hypoxia, and hypoxic injury to the heart usually is going to affect the ventricle, because if you think about it, it has more activity than the atria because it's thicker, right? The atria are priming vessels that only contribute maybe 20% to cardiac output. That's why you can have a dog like a Great Dane with atrial fibrillation, where his atria are not functioning, they're not contracting like they should, they're just jiggling around. Why that dog can walk around and not drop dead, right? Because you would think, oh, I've got 2 chambers of his heart not working, he should be dead. But the atria, again, they are not very muscular, thin-walled, priming chambers. It's the ventricle that does all the work. When hypoxia affects the heart, we're going to see primarily ventricular problems because that is where the oxygen demand and oxygen utilization is for the most part. Okay. We got a goat. So we have a goat, sudden onset, blindness, depression, and head pressing. Progresses to recumbency with opisthotonus and nystagmus. What is the most likely diagnosis? Okay, so here you have to know a couple of things. Number one, a little bit about caprine medicine and infectious disease. And number two, more importantly, neuroanatomical diagnosis, right? So almost always when there is a question on NAVLE and it's a neurology question, it's going to involve figuring out where in the neuroanatomy is the lesion, right? Is this above the foramen magnum, right? Is it a brain lesion? If it's a brain lesion, is it affecting the brain stem, right? What are happening with our cranial nerves and with our level of consciousness? Is it a spinal cord issue, right? Which is still central nervous system, but with spinal cord problems, we see paresis or disuse, and we should have normal cerebral function, right? They might not be able to walk, but they can still hear and, swallow and see. Or is it a peripheral nervous system problem? A lower motor neuron issue where we would have flaccid paralysis of everything. We may have respiratory issues. So, based on this description, right, we have blindness, depression, head pressing that progresses to recumbency and opisthotonus and nystagmus. Do you guys know what opisthotonus is? What that term refers to? It's okay if you don't. That's why we're here. I'm going to have to stop sharing so you guys can see me. Right? So, anybody know what opisthotonus is? No? Okay. Opisthotonus is a posture called decerebit activity. So it's head thrown back and forelimbs extended out. Hind limbs are going to be flexed. It's kind of like Shift Sherrington. Opisthotonus is a bad finding, right? It almost always means you have brainstem issues going on. You have injury to the brainstem swelling or lack of blood flow, something like that. Okay. So I will need you guys, please, to come off mute because I can't share my screen and see the chat at the same time because I'm working off just one screen here. Okay, so that's what opisthotonus is. So based on this description, blindness, depression, head pressing, opisthotonus, and nystagmus, where is the lesion? Where is the lesion? Is it CNS? If it's CNS, is it in the brain or is it spinal cord or both?
That's great.
Say that again. I didn't hear you.
Everything else looks.
Yeah, so it's above the foramen magnum, right? Where we're dealing with a central brain issue. So now let's look at our options, right? Sudden onset. Remember, sudden onset. So we have bacterial meningitis, caprine arthritis, encephalitis, listeriosis, polioencephalomalacia, and scrapie.
I'm leaning towards polioencephalomalacia, and I can definitely take out caprine, arthritis, encephalitis, and scrapie.
Yes, I agree with B and E. You can take those out because those are more, right? Scrapie is basically Creutzfeldt-Jakob disease. That's a prion. That's chronic, right? That's not all of a sudden blindness. That is progressive. Caprine arthritis encephalitis, we would expect also some description of more abnormal gait or abnormal examination of the limbs. So we're left with meningitis, listeriosis, and polioencephalomalacia. What do you guys know about listeria? Do you remember, what do we call that disease? Has a nickname.
Or silage disease or silage disease.
It's called circling disease because they circle. They walk around in a circle. There's no circling here. So we can eliminate C. So we're down to bacterial meningitis and polioencephalomalacia. Meningitis could do this, but bacterial meningitis in general is not very common, whereas polioencephalomalacia is something that we see in goats, especially with poor husbandry. So D is the correct answer for 9. Okay. All right, number 10. So we have a 3-year-old gelding. We have food reflux from both nostrils. A temp of 100.2, pulse rate of 42, respiratory rate of 12. Okay, so we have normal gut sounds, it sounds like. Which of the following is the most likely diagnosis? Cleft palate, esophageal obstruction, retropharyngeal abscess, ruptured stomach, or a small intestinal volvulus. So what do you think of those vital signs in this 3-year-old gelding? 102, 42, and 12. You think these are abnormal? Are they within limits? What do you guys think of those vital signs?
They're within normal limits.
Yeah. So have you guys seen like a colic or something on clinics? Right? A volvulus. Have you seen a horse with volvulus?
Yes.
Yeah. Do they have a normal pulse rate?
No.
No, right? They're trying to die. So we have normal TPR. We can probably rule out D&E, right? A ruptured stomach and small. I mean, I've never heard of a ruptured stomach in a horse. But I would guess they would have at least a high respiratory rate or something going on. So D and E, right? We can eliminate those. So we have cleft palate, esophageal obstruction, and retropharyngeal abscess. So this is a 3-year-old gelding, right? Would a cleft palate, would we see regurg from that? Or reflux? Yes. Would we see it before the age of 3? What do you guys think? Did this horse develop a cleft palate, or would it be born with one?
It would have been born with it.
Yeah, so we can get rid of A. So now we're left with B and C. Right? Esophageal obstruction and retropharyngeal abscess.
I think with the presence of food in the reflux, it's making me think esophageal obstruction.
Food reflux from both nostrils. Yeah, I'm kind of in between them, but I think it's C. I think it's C. Let's have a look. Was that 10? Oh, you're right. It is B. Excellent. Yeah, because we have reflux. Horses cannot vomit. So yeah, no esophageal obstruction. All right. All right, number 11. We have a 2-year-old cat. 2-day history of anorexia and vomiting. Intestines are bunched up. What's the most likely cause? Right, so even without looking at any more of the options, right? We have a vomiting cat. It has plication of the SI on an X-ray. What's your number one rule out?
Linear foreign body.
Linear foreign body, right? Linear foreign body. Perfect. Yep, so it would be E. Okay. And this, again, it's just a rote memorization, right? One of the GI things that the food animals get. So you just have to memorize that stuff. Hopefully you guys have, do you have vet prep or do you get the little flashcards? Yeah, what I did is I just made flashcards of all of the GI infectious agents of pigs and cattle, along with the respiratory ones, and then I threw in some poultry. The exam also looks at trends in the industry, right? Because they will have, they have a certain number of small animal and large animal questions, and then they will have some exotics or some poultry or avian questions. My understanding is last year they had did they have a lot of fish questions? I heard last year there was a lot of like aquaculture questions. Um, the last 5 to 10 years, backyard or having chicken coops, backyard poultry is the number one growing food animal industry right now. People having their own chickens. So there are definitely going to be more poultry questions on, NAVLEs these next few years than ever before, because it is now so popular for, folks with a little bit of land to have some chickens. Okay, what do you guys think about number 12? What do we give for swine dysentery? Lincomycin, penicillin, sulfa. Right, y'all say A, lincomycin?
Yeah.
Yeah, that's the answer. Okay, so our next session, because this is my, I have one session left after this one. So let me just stop sharing here. And I have a lot of folks on this time versus last time, which is great. So for the next session, we can either continue to do multiple choice questions, or we can do a neuroanatomic review where I go through neuroanatomy and cranial nerves and all of that stuff, how you localize a lesion. So just think about that. So when you join the next session, that's the first thing I'll ask what you guys want to do. If the answer is you want the neuroanatomy, what I'll do is I'll contact Dr. Soto and we will add another study session to do some more exam questions. That sound good?
Thank you.
Sounds good. Thank you.
All right. See y'all next time.